The telemedicine program, which links rural hospitals with the University of Mississippi Medical Center through video, is only one of more than 30 projects of the Delta Health Alliance.
What telehealth does is provide a way to take using technology to take the expertise and put it out into the rural areas. I work in the emergency department at university. It's pretty unusual to see a seizure in somebody this young unless they're having big time fevers. With time sensitive medical problems that have great distances involved, you really need to bring the expertise to the patient. DHA has been instrumental in getting the equipment to be able to do that and to establish that.
But while technology is useful in bridging the healthcare gap, the Delta Health Alliance also reaches out into the communities the old-fashioned way.
One of the nice things about the Delta is it's one of the most religious, spiritual areas in the country, and people congregate at their churches and are very interactive with their churches. And so the Body and Soul program sort of brings that spirituality and also the health piece together.
Body and Soul program has been a very successful program. For number one, knowledge is important.
In the past 6 months, we have been focused on being better. More fruit, more vegetable, more whole grains. We find that that's the secret. How much you eat, what you eat, and if you move.
90% of the participants in the program, and we have about 43, their levels have gone down tremendously, and that is a success.
All right, buddy, I'm Lisa.
We're going to continue this program because we believe in helping people to help themselves. I consider the church, the congregation, as my family, and we motivate and boost each other.
It's hard for the general population to realize that we're in the Delta, which is one of the most fertile lands in the world, and yet people don't have access to things like fresh fruits and vegetables. Community garden does more really than provide people fresh fruits and vegetables. It allows them to do something together.
We got community members come in and they chop the garden, they harvest the vegetables and stuff, and that has really made a difference when you can grow your own vegetables and when you're trying to make a difference.
One of our biggest success stories is the Delta State School of Nursing. We can measure the number of nurses that have increased in graduation. We can measure the graduation statistics, how quickly these nurses pass their board exam.
He came into the ER today complaining of being unable to breathe. He does have a long-standing history of asthma.
What's going on here? We got Mr. Jack's got some wheezing going on. O2 dropped down to 67 now.
COPD, asthma, emphysema.
But without the assistance of the Delta Health Alliance, the resources that they've given us, we would not have a simulation lab. We would not have a birthing room. Our enrollment would not have more than doubled at this point in time. The Delta Health Alliance also offers scholarships to nursing students. These scholarships pay their tuition, their fees, their uniforms, their supplies.
I didn't know anything about the Delta Health Alliance and the opportunities they provide this area until our instructor walked into class one day and said, if you're interested in applying for a scholarship and are willing to work in the Delta when you graduate, I have the perfect opportunity for you.
I decided to go into the nursing field. I wanted to go to a school that was close to home because I've already started a family in the Delta, so I knew I was going to stay in the Delta.
In 2003, our graduation rate was less than 50%. We've seen it go from less than 50% to better than 80%.
You are a nurse in and out of the hospital. Regardless to where you are, you find yourself helping people, giving them good advice.
So this has made a significant difference in the lives of these students.
We know that we're increasing the capacity for nursing in the Delta with that program.
The Good Samaritan Center is a nonprofit healthcare clinic for the working uninsured.
Roughly 3 years ago, my blood pressure was pretty close, 379 over 285, 295.
A man came in the the program that had been unemployed for about 3 years, and he had terrible hypertension, diabetes, and was cared for in one of our 21st Century clinics.
I went in, and the people realized how high my blood pressure was. Mr. Hughes, you threatened a stroke or heart attack. Ma'am, I've been like this for years now. But the thing about it was this, I didn't know what to do.
When Delta Health Alliance signed the collaborative agreement with the Good Samaritan Health Center, it took us from 2 days a week to see patients to full-time clinic, full-time staff of caring clinicians.
I started taking the medicine they put me on, I would say roughly in 13 days. Blood pressure wasn't normal, but it was way down, and they didn't want to believe how quick it had dropped. And I told myself, Leon, something is working. I said, it's the people's working in you, now you got to work with other people's.
I mean, when he walks in the clinic now, it's a different person than when I first started. And he does what he needs to do and wants to.
And that's what we're trying to teach people, is we're going to show you how to take care of yourself, why it's important, and we're going to help you be able to give you the tools to take care of yourself.
I started telling just about everybody I met, everybody I heard talking about illness, high blood pressure, they didn't have money. I told them about the Good Samaritan.
So to me, that is a major success story, and that is one out of hundreds. So yes, we've increased our patients, but we've also increased their level of care.
The Delta Health Line has saved my life.